Hi, this is Divya Prakash from nuclearmedicinesolutions.in, and in the last presentation of this section, we saw the importance of radiopharmaceutical dosimetry, and in this section, we are going to learn radiopharmaceutical dosimetry hands-on, how to do radiopharmaceutical in a normal routine clinical practices. In November 2002, we published the book called Radiation Safety Guide for Nuclear Medicine Professionals, and whatever I am going to teach in this presentation, these all have been given in the book, and that too in a very detailed manner. So if you wanted to read further, this can be a good source for reference, and people can learn about. There are two chapters: nuclear medicine dose assessment, internal dose assessment, and the CT dose assessment. These two chapters give a detailed outline about both dosimetry, and you can learn it from there. And if more detail, if you wanted to learn, there are course design for the dosimetry on the nuclearmedicinessolutions.in website, and Dr. Michael G. Steinman himself is teaching about this course, and he has made the dosimetry simple and easy to learn for everybody. This can be learned from this website directly. Now, when we are going to discuss about the dosimetry, at least basics we should be knowing about what is absorbed dose and what are the factors it has. So let's see those. And the formula for absorbed dose is d by dm, and it is absorbed dose per unit mass on any material, and the unit of absorbed dose is gray, which is also joule per kilogram, and the older unit was rad. The relations are given in this slide. Just you can go through. And the doses, the components which it has for the absorbed dose calculation, the components which it has is radiation characteristics of administered radionuclide, the anatomy for which the dosimetry is being calculated, and the biokinetics of the radiopharmaceuticals, means the isotope which is going to be injected or given orally, the body, and the pathway. These three things are going to account for the radiation doses. So let's see, if we divide all those things in different parts, it will have a mass of the organ, radioactivity administered, radiopharmaceutical uptake, resistance and clearance pattern with respect to time, the fraction of energy absorbed in the organ, the mode and the energy of decay, and the yield per nuclear transformation. If we assign the numerical values to all these components, it becomes this formula. Now this is scary, where all these terms are coming as a mathematics, and it is more scary when we do it physically. So to simplify, there are different methods are applied to so that it can be done easily. There are three systems for dose calculations. One is MIRD technique, that is medical internal radiation dosimetry. Second is ICRP, that is International Commission on Radiological Protection, and the third is radar committee, that is radiation dose assessment resource task force method. In the MIRD method, the publications from 70s, the number of publications have come, the S values, different charts have been given to simplify the dose calculations, and in 2009 they simplified their equations more, and they gave this formula. In ICRP method, they used to have this formula since 70s, but in 2015 publication 128 they synchronized with the MIRD method, and the formula is this, which is almost similar to the MIRD pamphlet. And the third method, which is also similar, that only terms and that how it is being done is a little different, but overall they are doing the same thing. And in radar method, this NS is again this time integrated activity, which is A tilde S, and in the MIRD method A tilde RTTD. So it is all same, and this S value is same as a dose factor or the decay dose factor, which can be obtained by just mailing to the doctor Michael J. Stabbing. He used to send if you ask for any DF value. So if you have NS, that is time integrated activity, basically we are supposed to have, and this DF value can be obtained, or it can be taken from the free sources. This Olinda software is already, this is designed on this method of radar technique, of where they just simply multiply with the DF with the time integrated activity. So these all the calculations, since they are bulky and they require a lot of man hours, so softwares would be easier, the use of computers would be easier to do, and for the therapeutic purposes it is required to have a software so that the work becomes easier. And there are different softwares available, which includes the Olinda, and there are other softwares like Dose3D, OEDP, RMDP, Peregrine, Planet Dose by Dojisoft, 3DRD, Rapid, Big Dose, MIMS, and many more. There are a number of software are available and which can be used for dosimetry purposes. But for diagnostic purposes, we'll see in the next slide what are the free resources available. And these all the softwares, this required 3D anatomical data from CT and MR, and images are fused with 3D activity distribution from the SPECT or PET data. For the diagnostic nuclear medicine procedures, the dose reports can be obtained from SNMMI website. They give free tool which provides, if you just put the activity and choose the radiopharmaceutical, choose the model for which you wanted to incorporate, you can simply get the effective dose, and they provide for the critical organ also, the dose to the critical organ. And however, the scope can be increased because then radiopharmaceuticals are limited. If it is having more number of radiopharmaceuticals, then it can have a better result. The radar people, they also provide this same kind of data, but additionally they are having this consent statement also, where they say if this much of this can be told to the patient, if this much of radiation dose you are undergoing for this procedure, then this is equivalent to this much of background radiation which you receive if you are not undergoing for this procedure. So they have this statement as well. So both of this can be utilized for the diagnostic nuclear medicine procedures, but for the therapeutic nuclear medicine procedures they are not applicable, and a special software would be needed for this. But at least we need to calculate the time integrated activity, where we need to have to calculate the area under this curve, which is drawn from the time and activity, means at what time what activity was there. So if we have these kind of things, we can simply get the doses. Now coming to the how many time points would be needed to obtain a good quality data. Generally it is called as 3 to 5 data points would be needed to have good quality of dosimetry. People may go for 3, but at least to have a good quality we need to have 5 data points. And what are the time points we should be having? So it is, many places it is written as 3 to 5 effective half-lives should be scanned, but since at the beginning we do not have a biological half-life data, so we can go for a thumb rule where we can say that we should go for one physical half-life scan, where the first data point would be at the time of administration and the last data point can be at the end of physical half-life, and other third, fourth, fifth data points can be divided in between if you are taking more samples. At least 3 would be required, but if you are having 5 it is better. So this way just we need to calculate the time integrated activity, and we need to use software for therapeutic nuclear medicine, and if it is diagnostic nuclear medicine we can simply calculate from the free resources which are available on SNMMI website or the radar website. So this way we will be able to do the radiopharmaceutical dosimetry in a very easy way, in a current clinical practice. Thank you so much. In the next presentation, we are going to see about the CT dosimetry in nuclear medicine, and there this dosimetry section will be, dosimetry talks will be concluded. Thank you so much. See you.